Hello, my name is Monica Maribel, and this week's assignment was to talk about agency regulations. Two agencies that I'm going to talk about are the Centers for Medicare and Medicaid Services and the Joint Commission on Accreditation of Healthcare Organizations. The Centers for Medicare and Medicaid Services were put into law on July 30th, 1965 by President Lyndon B. Johnson. Both Medicare and Medicaid services are used as hospital and medical insurance programs. The Centers for Medicare and Medicaid Services have had many changes and have now been protecting millions of families for the past 50 years. The Centers for Medicare and Medicaid Services works with the Department of Health and Human Services. They are in charge of supervising and managing programs such as Medicare and Medicaid, Children's Health Insurance Program, and the state and federal health insurances. The Centers for Medicare and Medicaid Services also collect and examine data, put together extensive research reports, and eliminate any fraud or abuse that can occur within a healthcare system. The CMS continuously ensures that healthcare systems are being provided better care and allow more access to healthcare coverage and improved health outcomes. The Centers for Medicare and Medicaid Services, CMS, manage the Standards of Health Insurance Portability and Accountability Act, and those standards include implementing electronic health records, guaranteed patient privacy and security, and enforced HIPAA rules and regulations. The Joint Commission on Accreditation of Healthcare Organizations is another agency that follows established standards of care. The Joint Commission on Accreditation of Healthcare Organizations has been around since 1951 and accredits and certifies 22,000 programs within the United States. The Joint Commission on Accreditation of Healthcare Organization is constantly improving healthcare for the public by giving the highest quality of care and providing safe and effective care to all of their patients. The Joint Commission on Accreditation of Healthcare Organizations certifies healthcare facilities and sets specific standards for each of them to follow. The Joint Commission on Accreditation of Healthcare Organization is also part of a two nonprofit program. The Joint Commission Center for Transferring Healthcare, which works to solve healthcare organization safety and quality problems, and the Joint Commission Resources, which is used to offer educational services and software that will aid in the accreditation experience. The Joint Commission on Accreditation of Healthcare Organization are the foundation of a process that has an objective to evaluate and help a healthcare organization. It helps the hospital or the organization to measure, assess, and improve the overall performance. Some standards they focus on are functions that are important in providing safe, great quality care to patients and individuals in resident care. Standards are set with expectations for a hospital or organization performance that are surveyable, reasonable, and achievable. Standards for hospital accreditation can be more than 250, and each standard can address anything from education, infection control, patients' rights, prevention of medical errors, medication management, and competency and qualifications of doctors, nurses, and staff.